Good morning. I'm Dr. Sean Coomer, Chief Medical Officer of the Kansas City Division of the University of Kansas Health System. I'm filling in for Dr. Steve Stites on this edition of Open Mics with Dr. Stites/Coomer. For athletes, their health and fitness is everything, which is why an injury can be devastating, especially for young athletes who worry about their high school, college, and even professional careers. Today we're learning how the keen eye and quick actions of an athletic trainer help keep one local athlete out of the operating room. But let's start with morning rounds. You have the chance to participate in a nationwide research program building one of the most diverse health databases in history. The University of Kansas Medical Center is a proud partner of the All of Us research program, and now that program is hitting the road. The All of Us Journey exhibit arrived in Wichita, Kansas today. That's where we find the lead tour manager for All of Us, Cesar Ruiz. Good morning, Cesar.
Good morning.
2 months ago, we devoted a whole show to All of Us. Tons of great info out there about that. But Cesar, in your words, what is the All of Us research program?
It's a good question. The All of Us research program is a program aimed to reflect the diversity of the United States with medical research, to be more inclusive of communities and people who were not originally included in medical research. Our goal is ultimately precision medicine, to be able to provide you that in the future in case you get sick, and that would be based on your biology, your environment, and your lifestyle.
So as you said, this is a national program from the NIH. Here in the Midwest, KU Medical Center is the lead institution of the Heartland Consortium. Other institutions are the University of Missouri, the University of Nebraska Medical Center, and the University of Iowa Healthcare. But people deserve to be included, even if they are not near any of those 4 medical centers. Hence, the Journey Bus. So you're in Wichita today, specifically Nomar Plaza. Why that location specifically?
We partnered with Juntos, and they have connected us with local partnerships here in the area to be able to reach out to the Hispanic community here and be able to include them in medical research.
If someone visits that tour stop, what should they expect, Cesar?
They can expect to interact with the Journey. It's our mobile exhibit. We're one of 3 teams that go across the country to underrepresented communities and areas to try and gather that large, diverse data set and that pool for participants for medical research who were not previously included. Here, you'll be able to create an account with us, as well as education, awareness, and any questions you have in participating with the program.
So how long will you be in Wichita, and what's the next stop, and how many people are there with you on the bus?
We have about a team of 5 people with us. We'll be in Wichita for the next 2 weeks. We'll be here in this area from Tuesday to Saturday from 1 to 7, and then our next stop next week will be Tuesday through Friday at the Colvin Neighborhood Resource Center from 11 to 5, and then after that we hit the road again and we are headed to San Marcos, Texas.
Okay, so Cesar, what would you say to someone that's on the fence about participating in that study?
There's a lot of different reasons why someone would be on the fence, security being one of them. We thrive and we can't always guarantee privacy or security, but we try our best. I joined for personal reasons. Both of my grandparents died early on of heart disease, so I wanted to join the program to try and be more proactive instead of reactive with my healthcare.
Thank you so much, Cesar. Appreciate all your work and being there, and we'll keep on trying to get the word out. If you're closer to Kansas City, you can visit our enrollment center here at KU Medical Center. Check out our previous episode or the website joinallofus.org/KC enroll. I want to welcome Logan Misbagel. She is a senior at Olathe East and a varsity soccer and basketball player. She'll tell us about a recent injury in just a moment. Also at the desk with me is athletic trainer Aaron Washington and Dr. Thomas Katzvai, a family and sports medicine physician. Joining us virtually is Dr. Brian Vopat, an orthopedic surgeon with the health system. But as we're about to learn, Logan didn't need to see Dr. Vobat for surgery. Logan, your season got off to a rough start this year. Can you tell us what happened?
Yeah, of course. So last season, about 2 games in, I was at practice dribbling the ball like any other day, and then my foot got caught on the grass and it popped, and then I instantly felt pain, and then I was done with practice, and then the next day I couldn't walk on it, so I went and saw Aaron, my athletic trainer. So yeah.
Okay. So what was the mechanism? It got caught, you said. Did it still get caught? Or
It
the whole...
almost like rolled forward, like if this was the top of my foot, it rolled, and then it popped. So I wasn't sure at first what it was because I've had ankle injuries before, so I was like, it's not my ankle, but don't know what it is. So.
Gotcha. Okay, and I think that's a common mechanism. We'll
Yeah.
talk about that before a little bit later. The next day, you were able to go down the hall at Olathe East and see your athletic trainer, Aaron. Aaron, you're with the University of Kansas Health System, but you work on site at area high schools, which is a fantastic program here at the health system. Did you already know Logan before this happened?
I did. Logan has seen me multiple times for, like she said, ankle stuff, and she's not afraid of getting bruises and seeing me for those things too, because she's a hard-nosed player. But she was having that relationship beforehand, before having her with the significant injury helped, because she knew she could trust me and come and see me.
That's fantastic. So you knew pretty quickly what kind of injury that Logan had. How did you know that?
You know, that's just with our training, with athletic training. We're educated in all the different injuries that can happen with sports. And so even though this is an injury that we don't see very often, we know it's a potential, and we want to be able to recognize it right away to reduce further harm.
This injury is called a Lisfranc injury, and it's apparently named after a French physician in Napoleon's army, so I guess it's been around for a while. So I'm going to turn now to Dr. Brian Vopat. Dr. Vopat, can you tell us a little bit more about a Lisfranc injury? And I understand it can be easily misdiagnosed.
Yeah, it's a very common one to be misdiagnosed. And another point there is there's actually an OB-GYN doctor in Napoleon Army that named it. But what happens is you injure the midfoot. It's like it can be a midfoot sprain to a injury that actually needs surgery, and it can be very subtle findings, and you have to be very careful when you're looking at it. And then you have to get X-rays, and then even on X-rays, it can be easily missed. The old literature used to show these can be missed 35% of the time, and a high litigation for the emergency room, just because it's something that you have to know that is a possibility to make sure you diagnose it correctly.
You hinted at it, but how commonly do you see this?
Well, in my practice, I tend to see it fairly commonly, but that's just because of the way my practice is. But in our athletes, you see it probably like 2% of the time. We looked at an NFL study where we looked the last 7 years of the combine, and I think we had 45 patients that had them. So they do happen. It's not completely very common injury, but something that you don't want to miss because it can cause something that have morbidity for your athlete or your normal person if we don't treat it appropriately.
Okay, and you know, and Dr. Vopat said he sees it a lot. He does specialize in foot and ankle surgery within orthopedic surgery, so I imagine you see it plenty. So is surgery normally recommended?
It depends the injury. So there's 2 different types. One's a stable injury and one's an unstable injury. And that's why you have to probably look at it with X-ray. And here at the health system, we have something called a weight-bearing CT scan if we are a little bit concerned about it. We're the only ones in the region that have that. And that can also help better differentiate whether it's stable or unstable. If it's a stable injury, like Logan had, unfortunately, we can treat these non-operatively. However, we have to make sure that's not unstable, because those are the ones that need to be fixed and can cause long-term issues if it's not treated appropriately.
So what is the biggest reason that Logan didn't need surgery?
Luckily, she had a stable injury. And then the big thing there is to let it calm down so it isn't something that continues to linger. So by them identifying it early on, we're able to allow it to put her in a boot, rest it, allow it to calm down, heal appropriately, so then she could get back to her activities faster that way.
Okay. We're going to hear in a few minutes about her non-operative recovery, but had she needed surgery, what kind of recovery would be needed there?
It's usually, we call it it's a year-ending injury in the sports in NFL or in basketball. It's a 6-month recovery. Usually, you have to put hardware in, and then about 5 months later, you usually take that hardware out. But it's usually at least a 6-month recovery time. So if someone injured it during the season, they're usually out for the season for that year.
So without that quick intervention, it could have been a lot worse.
It could have, and luckily her injury was the type that didn't need an intervention. So it was kind of a combination. One, they treated it very appropriately. Two, her injury was more of a stable injury. So and then identifying that it was stable, we could treat it appropriately so that she could recover quicker.
Right. So Dr. Vopat, I know you're on a tight schedule. You've got your uniform on to head to the OR. And you start in a few minutes. So before we let you go, we thank you for being here, making time. Do you have any final thoughts before you head into the OR?
No, I think it's very important, like, you have people that know what to look for. Like Aaron identified it and sent to Tom, who identified that was a Lisfranc very appropriately. And then we make a decision whether it's something that could be treated non-operatively versus operatively. So I think what they did was completely what we're hoping that most people are able to do throughout the community. But I think they did an amazing job, and they allowed her to get back as quick as she could.
Great. Well, Dr. Vopat, thanks for being here. Really appreciate it. Good luck in the OR this morning.
Thank you.
Logan was also in the care of Dr. Katzfei. Doctor, we have images of Logan's injury. What are we looking at here?
Yeah, so here we've got an MRI of her foot, and what's been circled there is the area of the Lisfranc ligament itself, where we can see a partial rupturing. And what you can see on the left side of that screen is the inside part of her foot. Just to the top left of that circle is her first metatarsal, the first bone within her first toe, and then just inferior to that, or just below that one, is the medial cuneiform. So what you see with the Lisfranc is the medial cuneiform attaches to the second metatarsal, and so that's where this ligament connects, and we see the rupture there. But at the bottom left of that medial cuneiform bone, just to the bottom left of that circle, you can see some whiteness that's there. There's some bony edema, which is at the medial aspect of the medial cuneiform, and that's due to the direct impact of the type of injury that she had sustained. The thing we see here that's actually reassuring, Dr. Vopak kind of alluded to it as well, is we don't see a major separation between the first and second metatarsal, which is good because that would be indicative of a more stable type of an injury.
Okay. So with surgery ruled out, can you take us through your evaluation of Logan's injury and what you recommend for treatment?
Absolutely, and Dr. Vopat alluded to it. So the first thing is that it was identified very quickly by Erin, and she knew that this was something significant. So getting Logan immobilized in a cam boot is the absolute first thing that we want to do. Mm-hmm. We need to protect these types of injuries so that they don't progress and potentially worsen. And so she was in the boot for approximately 6-ish weeks, and then based on reevaluation, and as long as things are not regressing, her pain's not getting any worse, we look to transition her out of the cam boot and get her into a carbon fiber insole. At that time, we also start physical therapy, because what we really want to do is get these athletes back as quickly as possible. So we need to strengthen that lower extremity. We want to work on her range of motion and make sure that we don't develop any stiffness, which is pretty common when you're immobilized for so long. It also allows her to get back to sports-specific training so she can get back to sports as quickly as possible, in basketball in her case.
All right. Yeah. So we heard from Dr. Vopat that 6 months, season ending. You just mentioned 6 weeks. So that's so after that 6 weeks, and I want to hear a little bit more, but how long does this injury take to heal beyond the 6 weeks?
Yeah, I'd say about 8 weeks tends to be fairly typical. Now that's just for the injury itself to heal. But now when we deal with athletes, we also need to get them back in a safe manner. So after that initial about 8 weeks, then we're getting into physical therapy. We can certainly tack on a few more weeks too as well. And so that can fluctuate depending on how the athletes will respond. So that timeline is roughly appropriate, what we would expect.
So we're going to get to Logan here. Thanks for listening to everybody talk about you and your injury. Really appreciate it. How's recovery going?
It's going great. Well, back when I got injured, I was in a boot for a while, as he was saying, and then I got transferred into that carbon insole. Then after that, I went to physical therapy with this beautiful lady named Renee. She's amazing. I love her. But we worked on a lot of stuff really with planting, because that was important, especially with basketball. In soccer, you have to be quick and move back and forth a lot. So that was important. And then now I'm moving into playing, and basketball season is coming up. So now it's just being consistent with still doing my workouts so I don't get re-injured. So
pretty excited to start playing basketball then.
Very.
All right, with a functioning foot.
Yeah, yeah, that'd be great.
Dr. Katzfei, can you, when do you think she'll be able to get back to full participation? Probably not in soccer, but basketball. Basketball season starts in 4 weeks for her.
Yeah, no, great question. And I expect her to be fully participating at this point, given the injury she sustained was back in March. So we've had plenty of time from recovery, and from everything I've gathered, also from the physical therapist, she's gotten the green light and she's ready to go.
All right, fantastic. So Erin, Logan spent a lot of time in physical therapy. We have a video of her working out here. What kinds of exercises is she doing, and how are they helping her?
She's doing a lot of hand-eye coordination and focusing on that foot agility. So a lot of her injury is right at the arch in her foot, and it needs to be able to be stable to absorb those loads with the full body weight and onto your toes. So she was doing the agility ladder, and then those pods are reaction lights. So she has to go and tap them, and she gets timed. It's really neat. It's a Bluetooth type of application that the physical therapist has on her phone to see how she's improved, and then she has to quickly react and change direction, which is all really good for her and her foot to get better. And this was one of her last days of physical therapy, so she's at her max and just kind of testing out on this day, so she did great.
So as a physical therapist, how do you know that maybe she's not progressing? I mean, is it pain for her, or is it something you see?
Well, for physical therapy, I'm sure the physical therapist would look at her function, her pain. They always take a pain intake, and her function compared to her good side, her bilateral side. That's definitely what they would look for.
So Logan, have you been able to start working with your soccer and basketball teams yet?
I have. So over the summer we had some camps, and I was able to participate in that. At that point I wasn't cleared for everything, but most things. But now I'm into weights for getting ready for basketball. So yeah.
And your mom's here. She probably held you back a little bit, to make sure you weren't overdoing it, right?
Yeah, she really wanted to make sure I wasn't overdoing it.
Okay. So it must have been great to start this whole process with an athletic trainer that you saw right down the hall and you've known for some time. How are you feeling now compared to when you first got hurt?
Much better. When I first got hurt, couldn't even walk on it. Was instant pain. Erin realized that. Obviously, I'm not really a person to complain about pain, I feel like. So, and she knows me personally, and I trust Erin, which is why I was able to go to her so easily.
So you told us that you're grateful Erin wasn't there just for your physical health, but also your mental health and well-being as well. Can you tell us a little bit more about that?
Yeah, of course. I think as an athlete, getting injured, sometimes it's overlooked for your mental health, because watching everybody being healthy and playing like a sport that you've played your whole life, that you love, can be a little mentally straining. So Erin always being there just for a friend. I know right when I got hurt, she was like, I'm always here just if you want to come hang out with me. But yeah, just having her to talk to and tell somebody about what you're going through is great. Yeah.
So Erin, why is it such a big advantage to have an athletic trainer that's always on site for games and practices?
Just to be able to not only just know them before they're injured, but know that they can come and see me for those injuries and address it right in the beginning, so that they're not just kind of limping around and saying, "Oh, I just hurt my arch, not a big deal," or it's just a knee issue. We're fine. We'll get through it. And then 2 weeks later, we need to really address it. We were able to start with her from the beginning for the very next day and get it immobilized and protected so that it had a good healing outcome.
So I'm a surgeon. I'd like to see a problem and fix it, and it's pretty quick. And this took a little bit more time. So it's got to be pretty exciting to see Logan's progress through all this over the months, really.
Yeah, it is, and it's fun to see that her sports season's coming up, and we'll get to see her fully. And that's the best part of being an athletic trainer, being in the high school with them, is not only do I get to know them beforehand, get to help them with their injury during, but get to see the successful outcome. So that's pretty unique that not every profession provides.
Yeah, I'm sure you're going to have a few people at that first game for you, the basketball game. So we're here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. So we're going to move over and check in with Dr. Hawkinson. So Doc Hawk, we were going to talk a little bit about vaccination, but we pivoted a little bit because in the news, McDonald's has stopped using fresh slivered onions and quarter-pound beef patties in several states to protect their customers from E. coli.
Yeah.
The CDC says that at least 49 people have gotten sick in this new outbreak, mostly in Colorado and Nebraska, but there is one reported illness in Missouri and one in Kansas. So what say you, Doc Hawk?
Yeah, well, first of all, I'll say get out and vote. I was able to vote yesterday. In Kansas, you can vote early. Right now, there are mechanisms as well in Missouri, so get out and vote, get your voice heard. Next, the E. coli. Yes, you were right, Sean. 10 states, 49 people have been infected, 1 death. There was 1 in Kansas and 1 in Missouri that we know of, but 26 in Colorado and 9 in Nebraska as well. So what is this? E. coli, we've heard about that. This is a bacteria that lives in our gut, but it also lives in guts of other animals as well. Particularly this E. coli, O157H7, which is just a designation based on the bacterial isolate itself, lives in the GI tract, the gastrointestinal tract of cows. Now, cows can either, excrete this, or there can be contamination of meat or other products, such as in this case as well, the slivered onions. But we've heard of other cases and outbreaks involving other non-meat products as well. Contamination during the growing, transport, or production of these products as well. So I think it is important to understand that many products can be contaminated. There have been outbreaks in the past. This is why it is so important that we let the experts, the regulatory experts, those people that are paid to protect us, do their job, such as the CDC, the USDA, the FDA. They are all involved in this investigation in trying to protect us, not only when we buy our products, but also in the production of those products. And it is very important that all of those plants and those factories that are producing these products for us to consume are monitored and have those safety regulations in place to protect us once we get the product as well, but also protect those workers. So it is vitally important. But what is this? What is the disease? So E. coli, particularly O157H7, can cause significant gastrointestinal disease. This particular entity, this particular disease, what you need to be looking out for is, number 1, if you had a McDonald's quarter pounder, but also 2, if you develop symptoms of illness. Typically, the symptoms will start 3 to 4 days after ingesting the food or the contaminated product. In this case, you're going to be looking for diarrhea and a fever of 102 or higher. If you are having those symptoms, please call your doctor or provider. In general, we do not give antibiotics for this. Why? You'd think that's strange. With an infection, we want to give antibiotics. But in this case, giving antibiotics can actually precipitate or increase your risk of getting what we call hemolytic uremic syndrome, or HUS, which can affect your blood clotting and, most importantly, infect your kidneys as well. Most of the treatment for this infection is just fluid resuscitation, so hydration with fluids, or if you need it, if you are that dehydrated, going to the hospital and getting IV fluids and getting strict IV fluid resuscitation. Only in severe cases, in very few cases, do we need to use antibiotics. But in generally, those are being tried to be avoided. But again, if you have these symptoms, it is vitally important to contact your physician or go to emergency department to get evaluated by a medical professional. Most people do recover in about 5 to 7 days.
Okay, so inquiring minds want to know, why quarter pounders, not Big Macs?
I think that's a good question. I don't know that we have an answer to that. I don't know why or how you would use just the onions for that, but obviously that's kind of what they found. But I think that's a good question. Why not other products? Because they do use probably the onions on the other products at McDonald's as well. But who knows? The investigation is early and ongoing. But we just wanted to keep people safe. So again, I think your point is very good. If you did eat at McDonald's, having any of those products with the onions, which are now taken out of the supply chain, if you did eat at McDonald's, having the symptoms of diarrhea and fever, please contact your medical professional.
Okay, well, Stu in my ears said they apparently use different patties, is what they said. So,
okay.
Anyway, so I agree. Please get out and vote. Don't vote once, not twice. Right? So.
Yeah, don't do it the I guess we can say the Chicago way. You say that living in Illinois, vote early, vote often. No, just vote once, but do it, get your voice heard.
Okay, so we know many of you have questions out there. Let's head to Studio B with ADC. Alexis?
How you doing? You know, you can say that. My dad used to say, vote early and vote often, like they do in Chicago. Don't do that. Don't do that. All right, Amy has a great question. Amy wants to know, has Erin ever seen an injury like Logan's before in her career?
Not to this extent. I've seen it as a student when I was doing rotations in college settings. I had one other student with the Lisfranc injury as well, but not often. She's really my second, and she's definitely probably the worser one of the injuries that we've seen.
Lucky Logan. Ruth Allen has a great question. Ruth wants to know, how important is the type of shoe an athlete wears for specific sports in order to protect the ankle or the foot?
Dr. Katzvai, you want to take that one?
You know, it's a great question. I don't think there's really necessarily a uniformed answer. And so I think the big thing that we try to encourage for our athletes and have our conversations with athletic trainers is really good prevention and proper preparation. So that means, you know, early conditioning prior to athletic seasons, and making sure people are doing a lot of injury prevention work with their athletic trainers, or if we ever have to get physical therapists involved. And so we see a significant reduction in injuries when we have the right preparation going into sports seasons.
Jeremy Yenser has a question. Jeremy wants to know, how can you tell when an injury for an athlete is ready to be able to withstand the intensity of just how physical athletes are?
Yeah, again, it's a great question, and that's one that it's a tricky one to answer sometimes because it's very dependent on the patient or the athlete themselves. And so this progress is monitored a lot through the physical therapy teams and colleagues that we work with. And what we eventually get to is a stage where we have a return to sport testing. And so that really puts them through a rigorous sport-specific exercises and movements to ensure that it is fully safe for them to participate, which Logan did a great job and she passed with flying colors.
Denise has a question, and I'll send this one to Erin. Denise wants to know, when it comes to athletic trainers, what do you do at the schools when you're not seeing an athlete for treatment or you're not standing on the sidelines of a game?
A lot of times we are preparing for those situations. So we're preparing our treatment plans, our who we're seeing that day, talking with coaches, talking with our school nurses, our admin team, and documenting all of our interactions between the athletes throughout the day. So documenting those injuries and the treatments that we provided.
I have a question for Erin. Teenagers are just notorious for playing through injuries. I mean, my son had a broken ankle and he just kept going because he didn't want to stop whatever he was doing. Do you have a specific eye? Are you kind of trained to see when you know a student shouldn't be out there, shouldn't be playing, because you can tell that they have an injury?
Yeah, and I think that comes from knowing them too. So knowing their typical mannerisms, knowing how they get up from a play, if they're quickly the first one up after landing on the ground, but this time they're slow to get up or they're really slunken. So some of those key things that we look for with their mannerisms, I hone in to and check on them when they come off to the side and see what's going on. And I think it's also just really important, the culture with our sports teams, that it's safe to be able to report injuries, and that comes from good supporting coaching staff that we have at Olathe East, and a lot of our schools do. We have that supportive role to be able to report those injuries so they feel safe to do so.
Well, this has been a great discussion. I'm grateful to our guests for being here. I also want to get final thoughts from everyone. So, Erin, I'll kick it to you first.
Oh, I think this was a successful outcome for Logan, and it went through all the right channels within our own health system, which was huge. And we were able to use aspects from the recent merger as well with Olathe Medical and University of Kansas Health System, with getting Logan into the right doctor to make sure we get her seen and having that diagnosis, and having her referred to our foot and ankle specialist with the University of Kansas Health System, and having a great outcome with physical therapy is going to be her key to successful return. So she had a great recovery with the whole team, and that's what it's about.
Logan, what are your thoughts?
Yeah, I just have to thank Erin and all of my doctors for immediately knowing what it is, because I know that they were saying that it's not usually identified sometimes, and I'm glad I'm getting back to play. So, yeah.
All right. Well, fantastic. Done a great job. Thanks for being here. Dr. Katzwey?
I'd just re-echo what Aaron said, and I think one of the biggest things for anybody listening is if there's ever a question or a doubt about an injury or a concern, have that conversation with your athletic trainer. Come in and be evaluated. I know a lot of times there's some hesitation about being forced to sit out, but like in her case, when we catch things early, we can really work on getting people back to their sport or whatever activity they like to do a lot faster. So open up and let us know.
Well, my final thoughts are really, there's a lot of support out there. We're seeing a great example here of an athletic trainer embedded into a high school, working with student athletes and a couple of physicians, a surgeon, and also a sports medicine non-operative specialist that worked together to get this athlete back in the field, and no doubt helped her mental well-being beyond what happened with her Lisfranc injury. So there's opportunities out there, so please look for them and don't hesitate to reach out. Don't be afraid. So thanks again to all of our guests and to our audience. We'll be back tomorrow with All Things Heart.
Haley Taylor found it right here at the University of Kansas Health System. I'm Alexis Del Cid on the next All Things Heart. The doctors at the health system who saved her life after other ones told her she didn't have a future at all.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.